When night falls, when we can finally forget about the virus and close the bedroom door to spend time with our partner, nothing happens. In fact, births are declining around the world. Is this what the future holds in store? There will still be babies, but perhaps less. Many countries are reporting historically low birth rates during the pandemic, as much as 10% less in some places. Family planning during the coronavirus pandemic has become difficult. After all, it's hard to get into the mood or be optimistic about the future during a pandemic. Hello and welcome to our COVID-19 special. I'm Monica Jones in Berlin, a city that doesn't feel like it's going to be deserted anytime soon. There's still enough hustle and bustle despite the pandemic. But who knows what the future holds? And it's that question that seems to keep many couples from having kids now.
A children's playground eerily quiet. The numbers are out. Italians are having far fewer babies during the pandemic. They, too, have had to put their family planning on hold. Morena and Vincenzo just bought a new home in a suburb of Bergamo. A big step for the young couple, and everything is ready for the next.
Questa sarà la camera dei bambini.
This will be the children's room. It has yet to be set up. We want to put in 1 or 2 beds depending on the size. We also have some space downstairs, which could become another room for the children.
Che potremmo allestire anche un'altra camera, sempre per I bambini, ecco.
Vincenzo and Morena were planning on getting married last summer before their move, but they had to postpone because of the pandemic. And having kids before marriage, for the 2 devout Catholics, was not an option.
L'unione, crearsi una famiglia propria.
For us, marriage means union and creating a family of our own. Marriage, home, family and children. Moving was supposed to be after the wedding, but we had to switch. While the individual reasons differ, the situation is emblematic for hundreds of thousands of couples across the nation wanting to have children. Exactly 9 months after the start of the lockdown, in December, here in Italy, the birth rate dropped by more than 20% compared to the previous year, with many couples calling off their plans to have kids. The birth rate in Italy has reached a historic low. But even before the pandemic, Italy was left trailing behind most of its neighbors. On average, women in the EU had 1.55 children in 2018. In Sweden, this number was 1.76, in Germany 1.57, and Italy, second to last in the EU with just 1.29 births per woman. It is too early to determine with certainty what exactly is causing Italian numbers to drop even further, says sociologist Giulia Rivellini. The pandemic is likely affecting couples' sex life. But more importantly, financial security seems to be the driving factor in the decision not to have kids.
I think that Italian young couples are becoming much more economic rational than emotionally convinced that it's important to have another child. So they're maybe more worried about the future of children.
Buying a house, postponing marriage while working full-time. For the moment, Vincenzo and Morena have a lot on their plate. But that hasn't changed their wish to start a family of their own as soon as the time is right.
Nathalie Nitsche is Deputy Head of the Laboratory for Fertility and Wellbeing at the Max Planck Institute in Rostock, and she's joining us now. Good to have you with us. Let's start with the obvious. How has the pandemic impacted demographics so far?
Quite a bit. We have seen a lot of excess mortality in many countries in the world. I think that is currently the biggest factor, but births are also going to be much affected, as we are just starting to see. And then, of course, migration has been halted across Europe and the United States. That's another factor that is affecting the demographics right now.
Of course, so there are various factors, but let's stick to having babies. What are the driving factors for couples to decide whether or not to have children?
Yeah, before I get to that, let me summarize a little bit of what we know. Births happen 9 months after conception. So we just got data in from a variety of high-income countries for births that occurred between November 2020 and January 21. And what we do see is a huge baby bust across the high-income world. For example, Spain in January has seen a decline of about 20% compared to births in 2019. Not all countries are affected, specifically Southern Europe, Eastern Europe, also Taiwan, South Korea, Nordic countries, and Germany, interestingly, haven't seen that decline yet. But of course, the story is still unfolding.
So people are handling the worries differently, or is there a common thread that you see?
That's a really good question. And honestly, we don't know yet as the story is still unfolding. Couples' fertility behavior is affected by many factors. First, there needs to be a couple. So partnering is a big piece in that story. And partnering is certainly right now kind of disrupted by the distancing measures. I expect that partnering effects will only be seen later on in declining births. Right now, it's probably economic insecurity that couples had during the first wave, anxiety about health, about what does it mean if I get sick, if I have a baby now. So I think couples during the first lockdowns have postponed, not yet knowing if they will catch up later.
Would you say that this is all in the mind? Are we talking about existential worries getting in the way, or are those worries actually affecting a man's or women's fertility in a biological way?
That's a really good question. I don't think mind and body can be disentangled that much, because literature and epidemiology actually shows that stress and worries and emotions really affect health, the immune system, also probably the reproductive system. Interestingly enough, the literature is all in the medical and epidemiological realm, and we don't know yet much in fertility and demographic literature how health shifts or worry shifts may affect fertility rates later on. But I do think worrying is not only affecting behavior and being more careful with contraception, perhaps lowering sex drive, but also could have effects on the reproductive system. I've seen an article on irregular menstrual cycles of women that have increased during the lockdowns that could have effects on ovulation. So that would be stress effects, but then there could also be, of course, COVID effects on pregnancies and reproduction, which we still know very little about. That is still unfolding in the studies.
All right. Of course, I mean, we learn pretty much every day something new about this pandemic. And you just mentioned, social distancing obviously doesn't help when it comes to get babies. Do you think that couples will, catch up once the virus is under control? What do we know from previous pandemics?
Yeah, that's a good question. From previous pandemics, for example, the flu 1918 pandemic, we do know, or 14 to 18, that there was a big baby bust, so birth decline, that was followed by a catch-up, quite a hump. That is usually what we see after these disastrous events, disasters, recessions that affect fertility to decline. But here, it's a very different situation. It's an economic crisis, it's a health crisis, and we really don't know when it's going to be over yet. So I assume there could be small declines and small humps. For example, the first wave, depression and fertility, could be followed by a little bit of a hump, maybe in the births that then happened during the summer. But now people are seeing, oh no, this is lasting. So another postponement could be going on. It's very difficult to predict. But the distancing certainly has effects. First of all, not finding partners. Second, families who are very stressed taking care of their children who are not going to school will likely postpone having another child. That could very well happen. So we could see decreases, first birth, second birth, third birth. This will still unfold.
Okay, and you keep an eye on it. Nathalie Nietzsche from the Max Planck Institute. Thank you so much. Now here's some news. BioNTech Pfizer just announced their vaccine is 100% effective in 12 to 15-year-olds. Some good news, even if the pace of vaccinations is still uneven around the globe. Time for Derek to answer your questions. If some countries vaccinate now and others later, will it impact the drive's success in vaccinated populations?
It very likely would. Let's look at the current playing field for a minute. As of today, well over 550 million doses have gone into arms worldwide in just a few months. Sounds great, until you consider that around 2/3 of them went to people in just 5 countries, with another quarter of them distributed in only 15 others, including many countries in Europe. Just 10% of all doses have been given in the world's other 175 nations. For the obvious reasons, this is a huge problem ethically, but it also poses a clear danger to both vaccinated and unvaccinated alike. That's because in the last several months, we've seen the emergence of dangerous new variants. Now, for complicated reasons related to how it replicates, SARS-CoV-2 doesn't mutate as quickly as some other viruses out there. The flu mutates much faster, for instance, but the coronavirus does change, and theory says evolutionary pressure from measures like mass vaccination can cause it to change faster. Although it's an unscientific way to describe the situation, you can think of our vaccination drives as an attempt to corner the virus and stamp it out, while it, on the other hand, constantly looks for an escape route. It's already like trying to herd cats, and the longer we leave people unvaccinated, hence unprotected, the more and better opportunities we give the virus to mutate into forms that might be more contagious or more deadly, or simply unaffected by our vaccines. So it's a kind of race to control the virus before it can change in those ways. And if we stumble in that race by not vaccinating everyone fast enough, the virus will very likely rebound in new forms, also in countries that thought they'd vaccinated their way out of trouble.
That's all for now. Thanks for watching.